He shoots, he scores, he gloats.
Louise, Pat was just telling me his state has community rating.
Everyone pays the same rate, no matter their age, even if they smoke or whatever. Does it work?
My health insurance went from $1,200 to $3,200 a year.
More than double?
Yeah, thousands dropped their insurance. I mean, we actually have fewer covered now than before.
Well, Congress can do better than that.
If we send them that message.
To send Congress a message on flat community rating, call today.
I believe every older American deserves the security of quality health care. We can do it this year, and we must.
They're fighting to preserve and strengthen Medicare, new coverage of prescription drugs, the beginning of long-term care. Older Americans continue to see the doctors they choose. The AARP calls the president's approach, quote, the strongest and most realistic blueprint to date for achieving our goals. Call Congress. Tell them you're standing up for the president because he's standing up for you.
The people of Kansas often still bear the spirit of their pioneer forefathers. Strong and independent, they feel the need to care for their own. Caring for one's own takes many forms these days. Ransom, Kansas, population 400. 8-year-old Dustin Kraft suddenly began to have convulsions without any apparent cause. Dustin was taken to the Griselle Memorial Hospital emergency room. Minutes after Dustin arrived, a nurse practitioner treated him while consulting with physicians at Hayes Medical Center through a sophisticated interactive video network. In years past, Dustin would have been airlifted to Wichita or Kansas City for specialized treatment. The cost, risk, inconvenience, and concern of his family would have been overwhelming. Instead, Dustin received immediate specialized care and was home with his family in time for dinner. Ransom, Kansas is part of a 7-state pilot project to help small hospitals survive through participation in a rural health network. It's networks like these that are pioneering healthcare changes and saving lives like Dustin's.
Why is it necessary for a community to be part of planning their own healthcare system?
I'm convinced that the role of the community is critical in at least several different areas. I'm convinced there's got to be community involvement in the planning stages of a community healthcare system, as much as anything to get people involved. And the second thing is, I think each community's needs are unique, and it's only the people of the community that can sit down and together work out what parts of a healthcare system they want, they can afford, they can support, and what parts of it they're going to have to perhaps network for or go to neighboring communities for. And I'm not sure that anybody can come in from the outside and tell a community, or that any one part of the community, for instance, just the providers, can tell a community what needs to be part of their system.
I think as we look across the state at the whole Kansas health reform issue, there is no single player more significant than the player of the community, and that the community really begins an effort in a change, and the community is the responder to an effort of change. And so for our efforts, there is nothing that we fund or no role that we play as a grant maker where the center is not the community. And we say, as we talk about projects for adolescents at risk, that it takes the whole community to raise a child. I believe it takes the whole community to move forward and to advance a health system that is responsive and articulate and visionary, and that is what we need to do in Kansas.
Communities have such an exciting opportunity. Communities are going to be involved in changes never before seen in healthcare. Certainly there's going to be a new way to provide health care. Some kind of reform is going to happen in this country, and people have a real opportunity to become involved in determining what's going to happen in their own communities. Healthcare is a very personal, a very emotional issue. Everybody has an ownership stake in how they receive their own health care. I don't know of another time when people in communities can get together and talk about, as change occurs across the country, what are the changes that we want to have happening in our communities, and how do we make that occur? I think it's going to be a lot of fun. I think it's a great time for communities.
What is the role of healthcare providers in helping plan a healthcare delivery system?
Healthcare system has to fit the providers and their expectations, or I think it's difficult to retain them. So I think providers, when they want to come out to a rural area, they have certain needs and certain reasons why they became a physician or a mid-level practitioner. And I think they have to play a key role in making sure that that system comes close to their expectations, or small towns won't be able to keep them.
The word networking is somewhat of a buzzword today. What does networking mean to you?
Networking means formal cooperation. Networking is probably a term that we've heard for maybe the last 10 years, and it gives maybe an informal feeling. You know, we go to parties to network. We join the Chamber of Commerce or the Rotary to network. I think in healthcare, especially in communities who are looking at devising a system to support their residents, it will have to be a little bit more formal, and it will have to mean that people come together and share solutions for their unique situations. Each community is different. Each community will demand a different kind of solution. Each community will demand a different array of services, different partnerships.
We've come to realize that every rural setting can't have everything. And so in order to provide services that we feel like our community needs, we go together with other communities to figure out a way to provide that particular service. It can be anything as small as maybe a physical therapist or a speech therapist or mammographic services. But it could involve sharing of physicians. It could involve sharing of management of hospitals. It could involve sharing of large amounts of capital between communities. You know, maybe joint ownerships. And you know what that means out in rural Kansas maybe is people in communities that in the past have not gotten along well, have been maybe cross-county rivals in sports, or where you didn't want your kids going to that town. Learning to get along and share things that you realize as a community are vital to the health of your people. And I think those of us that have been working on this issue for some time see networking as a very vital part of building viable health care for our Kansan people out in the country, our rural Kansas folks.
Sharing healthcare resources and responsibilities are key functions of an integrated health delivery system. How does this work?
An integrated community health system is at least the majority of the providers in a community, if not all of them, working to provide a system of healthcare in a community that does not have overlap and it doesn't have gaps. In other words, they work together to provide what the community needs for a total healthcare system.
I think integration will be very important to the future, primarily because I think it will bring residents of Kansas, consumers of health services, a whole different expectation for what kinds of health and wellness, quality of life they can achieve in their lives, in their communities. It will hopefully make things smoother for them as they need health services. It will give them opportunities for education. I think it will make them feel more confident about living in their rural communities because they'll know the services they need are there. They'll know that maybe they won't get lost in the shuffle or fall between the cracks. And they'll have a sense of confidence from that. I think that will do a lot for communities' well-being, but certainly for their health and well-being.
When healthcare mandates are made at the national level, how will it affect small rural communities?
We certainly have seen a lot of things happen over the last several years as far as the delivery of healthcare services in rural America, and that's particularly true in states like Kansas. And with reform on the horizon and the fact that we're going to have to reorganize the way we deliver healthcare services in rural communities, it's going to be important that rural communities be able to get together and develop new ways of providing primary healthcare services to the residents of their communities or counties.
First of all, I think the national concept, which many people have accepted is very legitimate, is that people in all communities will have available to them a certain package of services, a certain ability to access health care in a variety of fashions without the financial dilemma of having a barrier to those services based upon their ability to pay. And so I think from a national perspective that will change a lot of the directions and open up the accessibility of services certainly from a financial point of view. What is unclear on a national level is what this will do in rural communities to actually see that these services are provided within their communities. But I think once we're able to break down at least some of the financial barriers and the philosophical barrier of what people deserve to receive as far as health care, I think that will open up a lot of additional opportunities, particularly in the rural communities, to develop these kind of services that the people need in those areas.
20 years ago, there was no such thing as pre-hospital emergency medical care. Ambulances were over here, in their own field, sometimes literally, and hospitals were over here, and the two did not, very seldom did they relate. Community health was an almost unknown, relative to hospitals. Today, all those players in our area are sitting down and talking together, and there's going to be a lot more of that.
What role do you see mid-level providers such as physician's assistants and nurse practitioners having in the future?
I think there's definitely a role for the mid-level practitioner for the future. We are using it here in the Reno County Health Department and have for a number of years. Nurse practitioners, physician assistants are two of the mid-level providers that we find work very well to work with people when they have less than the most acute situations on hand. And you think about it, most of us are not in a hospital very often in our lives. We more oftentimes than not are out trying to stay well and healthy and get by with minor illnesses, where if we just could have someone help figure out what we need and order us a prescription or help us take care of a minor problem, we really will get along fine. Mid-levels work well for this.
Why should a business leader, government official, or even an individual become involved with their community's healthcare needs?
When community leaders reflect upon their role, many of them have a very unique vision of what can and should be done in their communities. What's very important is that community leaders exert that role to inspire others to make that particular vision a reality.
I believe we're the 7th fastest aging state in the nation. We need a call to action. We need to know that the older adults in our most rural communities can have efficient, cost-effective services in their homes. It's very important to the future.
I don't know of any other time in the history of healthcare when we've been able to sit down and say, we can design a system that will be there when we need it. And as the change unfolds across the country, that we can join hands with other communities and together say, jointly we can do what we could not do individually.
During the next year, we will find ourselves involved in a national debate on healthcare reform, just as you're going to be looking at how you're going to change the delivery structure in your communities. At the national level, we're going to be looking at an overall change in the delivery structure. This is not going to be accomplished overnight. It's going to take time. It's not going to be a sprint. It's going to be a marathon. This is your opportunity to take part at the local level and help us all to achieve those goals.
Yes, the healthcare environment as we know it in Kansas is changing. Communities that want to take care of their own are finding new ways and new technology to do so. We are still pioneers, And like our forefathers, each of us must play an important part in making changes that the new frontier of healthcare reform will require of us all. No matter what occupation we may have, farmer, homemaker, doctor, lawyer, or business person, sometime in our life, each of us will be touched by our healthcare system. That equalizing factor should mold us into a unifying force in the quest to make Kansas healthcare a model for the future.